And I hand the floor to her.
All right,
It's all
you,
you.
Angel. So today we're going to be doing lots of live demos, but because of the noise of the Halo and BBL device, we just can't do that today for sound reasons. So we're going to have some video looping on the back screen for you to watch. But what I want to talk to you today about is the Cyton device, which is the BBL and Halo. So BBL stands for broadband light, which is also intense pulse light, but it's branded through Cyton, and that's why they call it BBL. So what makes BBL different from IPL is it just gives us a broader range of wavelengths that we can treat more issues. The Halo is a laser, and we'll talk about that a little bit later, but those are the two devices that we primarily use in the non-surgical department. So BBL, what does that treat? The main thing it's going to treat is pigment, and it also stimulates collagen, so it's anti-aging. So if you have brown pigment, so that's sun damage or freckles or just age spots from over the years, or redness like rosacea or acne, broken blood vessels, the BBL is really going to be the best option to treat those. And like I said, it's also anti-aging, so it's going to give you some collagen stimulation as well to work on those fine lines and wrinkles and texture of the skin. So with BBL, there are a couple of contraindications to when we don't do those. The first one, which is one of the most important, is sun exposure. So sun exposure 2 weeks before or 2 weeks after the treatment is going to cause a lot of complications, which could burn the skin, blister, scab it up, and cause some pigmentation problems. So you want to make sure that you're really out of direct sun for a couple of weeks before and a couple of weeks after the treatment. That kind of gets into a negotiation phase with some patients about how much sun that is. Typically, if you're outside for more than 45 minutes to an hour with sun protection, that's a bit too much sun because we don't want you to have any kind of sunburn or any kind of tan coming into the office, or likewise having the treatment and then getting out in the sun after. So this treatment really is best to be done in the fall and winter when our sun exposure is more limited. The other contraindication is sunless tanning or spray tanning products. Even the glow creams that you do at home, we don't want you to use those over the area to be treated for about 4 weeks before the treatment. And then the last one is going to be more for darker skin tones. So IPL and BBL is a serious contraindication for darker skin, simply because we can hypopigment your skin or make it a lot lighter than your natural skin tone, or hyperpigment, and that would make it darker than your natural skin tone. So BBL and IPL are not appropriate for darker skin tones. So when you come in for your treatment, basically what you're going to do is get your picture made. We'll do some consent forms. I'll cleanse the area that we're going to be treating. Our most common areas are chest, neck, face, and also the back of the hands, but we can really treat anything that you want at all. But once we cleanse the skin and get you ready to go, I do explain everything to you prior to the treatment, but you'll experience 4 things with the treatment. You'll hear a beep of the machine. You'll see a bright, startling light. Now you're going to have goggles on to protect your eyes, but you'll still see that light. You'll feel a snap like a rubber band, and then it's also going to get warm. And that happens every single time we do the treatment. It is a little bit uncomfortable, so I have some things I can do to make it more tolerable for you, but it is a little bit of an uncomfortable treatment, although most people can tolerate it just fine. The first thing whenever I get started, I apply an ultrasound gel over the skin. That's used for 2 reasons. It's allowing my device to glide easily across the skin, and then it also acts as kind of a conductor to release the heat that's in your skin and let you cool down a lot faster, kind of like when you apply aloe vera over a sunburn. So the treatment itself, this is going to be showing us a treatment of a chest. We do multiple passes over the area. We follow what's called the Forever Young Photofacial protocol. So we do passes for red pigment. We also do passes for broken blood vessels, specifically for working around the face. And then we do passes for brown pigment as well. BBL is best done in a series, especially if you've never had them done before. So it's best done in a series of 3. They're usually about 3 to 4 weeks apart, and that all depends on your schedule. And then after you do your initial 3 treatments, then you can probably get by with doing those just once a year annually. Or if you've started working on your face, then you can eventually move on down to your neck or chest if you'd like to do that. Downtime really varies per patient, but if you have a lot of brown pigment that we're working on, you can expect your brown spots to be a lot darker for about 7 to 10 days after the treatment. Now, they're not going to be textured or flaky. They're not going to fall off like what a chemical peel would do, but you might feel them just a little bit. They're commonly described as coffee grounds. But one thing I do want to point out is if your brown pigment, your excess brown pigment, is not that dark to begin with, don't expect your brown spots to be significantly darker. So just kind of keep that in mind. They do microscopically exfoliate away at about 7 to 10 days. The other thing that can happen is potential swelling. Now this is hit or miss with BBL. Some people swell the first time and not the second time. Some people swell a lot the second time and not the third time. So it really is going to depend on you and your skin. Primarily if we're working on a lot of redness like rosacea or broken blood vessels on the face, you will probably go ahead and swell a little bit more. Swelling is typically going to be about 2 to 4 days with BBL, and of course that varies, but it could look almost like you've been crying all night where your eyes are a little bit puffy, or you could even be a little chipmunky just across the cheek. And there really isn't much we can do about that except just to prepare you for it. Also, we can find that you could bruise a little bit. So the little broken blood vessels on the face, they're weak because they're there for a reason. And the energy from the BBL is pretty intense. So that could pop one of those little blood vessels and you might get just a small little bruise over that area. The good thing about BBL is you could put makeup on immediately if you needed to. So if you were gonna go out and run errands after your appointment, you could bring makeup with you and put it on and just go on about your day. Don't plan anything important socially for at least 5 to 7 days after the treatment. So don't put it right up against like a wedding or a vacation or anything like that, just because we don't know what your downtime is going to be like. The next thing we'll talk about is going to be the halo. So the halo is not like the BBL, it's an actual laser. So remember, the BBL is a light treatment and the halo is a laser. So the laser is going to give us multiple depths or wavelengths that we can treat the skin. And the things we treat the most with halo are sun damage, textured skin, lines and wrinkles. We can work on pore size, redness, rosacea, acne scarring, traumatic or surgical scars. Those can all be treated with halo. The thing is about halo, while we can treat all of this, you have to really prioritize what you want treated first. So if you want to work on tightening and firming, then we need to do a halo specifically customized for that. And then if you want to work on pigment, then we need to do another halo specifically targeting pigment. So we really can't treat everything at the same time, although you do see benefit from both treatments or from treating one over the other, but you will need to plan on doing a couple of halos. Now the halo is a bit more uncomfortable than the BBL. So traditionally we have just done topical numbing cream like you would get for filler or microneedling or things like that. But over the past several years, we've added Pronox, which is laughing gas. It's the same thing that they do at the dentist office. And that's what I typically use for all of the halo treatments. We can also use it for the BBL if you want as well. So the laughing gas is really going to significantly cut down on the discomfort during the treatment and also work on your nerves, because when everybody comes in, you're going to be a little bit nervous. So it's going to help relax you with a little bit of your anxiety that you have. With the gas, you don't have to have anybody come with you. It's out of your system within a few minutes, and typically within about 10 minutes we can let you go. But the halo is a lot more uncomfortable. You will experience certain things with it. You won't see that bright light that you see with the BBL because this is a little red laser. So you won't see the light with that. You won't hear the kind of popping or the startling sensation that you feel with the BBL because the halo is just more continuous. So that's going to kind of be going on the whole time you have your treatment done. The downtime with the halo, a bit more significant than the BBL, but also very predictable. So when you are done with the treatment, you're going to be hot for about 30 minutes to an hour. And usually if you live kind of locally, by the time you get home, it's getting a lot more tolerable for you, but it is going to be pretty hot. Throughout the day, your skin will just continue to be red, but it's going to feel more like a sunburn throughout the day rather than that intense heat from whenever you were finished with the treatment. The next thing you're going to experience, though, is the next morning when you wake up, you're going to be intensely swollen. So I cannot explain this enough that you will be very swollen after the halo, especially if you add a BBL on top of it, because there's just a lot of inflammation and histamines happening in the skin when we do the halo, so you will be very swollen the next day. And then the second day is worse, surprisingly, but the second day is worse. And then day 3, it's going to start getting a little bit better. Day 4, significantly better. The swelling is much, much better on day 4. The way you can help with the swelling, if you're able to take NSAIDs like ibuprofen or something like Aleve, you can take those before the halo and kind of throughout the day. You can do antihistamines like Zyrtec or Claritin. You can even take some Benadryl at night. Sleeping elevated will help with that as well. And this is the same for BBL if you're concerned about swelling. But sleeping a little bit elevated is helpful as well to cut down on the swelling of the halo. The biggest thing is just be up and around. You don't have to be bedridden after you've had the laser. Staying upright as possible is going to help cut down on that swelling. Now, while you're getting to peak swelling about day 2, your skin's going to start getting pretty rough and flaky, and that's going to be essentially the burned skin that we created with the laser. That's going to need to start exfoliating off. So that flaking skin is about a 5 to 7 day process, and then it just kind of exfoliates away, and then typically by day 7, your skin should be pretty smooth. So whenever we're talking about downtime with the halo, 3 days of swelling, about 5 to 7 days of the flaky, dry skin. About day 7 is when your skin should be getting much better. So I wouldn't plan anything socially important for at least 5 to 7 days, if not just a little bit longer with the halo. It's best also done in a series. While I don't necessarily want to do 3 halos unless you have significant issues that we need to work on, usually people can get by with just 1 or 2 halos initially, and then at least 1 per year, or sometimes you can stretch it out to every other year if you're taking really good care of your skin with products and other treatments in the office. If you have lots of things that you want to work on at the same time, if you have a lot of sun damage or freckles or rosacea, you want to work on tightening and firming, then it's a really good idea to put them together to do the BBL and halo at the same time. You'll have a little bit more downtime, but it really won't extend out past that 5 to 7 days, but it really gives you the ultimate rejuvenation whenever you can do them both at the same time. Now, if you were thinking about any of the packages that we have today for this special, we have the bronze, silver, and gold package. If you were just thinking about 1 BBL and 1 halo of your face, then you definitely need to do the silver package. If you want to add any other body parts to that, if you want to throw in your chest, you want to do your neck or your hands or anything like that, you'll want to go ahead and do the gold package. I have had several patients today and yesterday want to do all of it at the same time, all the BBLs and all the halos at the same time, and they ended up buying a couple of packages. So that would really be a good way to save extra money and then get those credits that we have through the office and also the extra skincare products. So I think Angel has some questions. Hopefully that's been helpful. I know it's been kind of fast, but I hope it's been helpful to give you information.
I do have some questions, and also know that we're struggling, obviously, casting our 2 videos, the BBL and the halo. We are going to download that onto YouTube so that you can watch that in a little while if you would like to. It'll be available for you. And know that the one for the chest was the BBL and the one for the face was the halo. And then also remember the packages that she talked about. So, questions. What is the usual downtime for the various facial laser treatments? I think you talked about it a little bit, but remind us.
So BBL brown spots are increased, and that's going to take about 7 to 10 days for those brown spots to microscopically exfoliate away. You don't see them falling off. So about 7 to 10 days for those brown spots. They do reach their peak darkness at about day 2, and then they start getting better after that. Swelling, variable with BBL, it could be anywhere from 2 to 4 days, maybe up to 5 days of swelling. Sleeping elevated, antihistamines, NSAIDs like ibuprofen, Aleve, those are great to do as well. And then bruising, that's kind of hit or miss. It could be a few days for that, or if you take a long time to heal, it could be a little bit longer than a week. But you can put makeup on after that. Halo, hot, really hot for about 30 minutes to an hour. Then a sunburn feeling the rest of the day. When you wake up the next morning, intensely swollen. For those of you who have face recognition on your phones, it won't work. Just trust me on that.
That's right.
It won't work for at least 3 days. Flaking skin about 5 to 7 days. Typically by day 7, you should be pretty much back to normal. That's for the face. Neck, chest, hands, those take a little bit longer to heal, but they're also a little bit easier to cover up.
And I was going to say, it's not like you're down as in surgery. I mean, I came to work day after. I did too. And you did too, and we all do. Now, we work here, so that's awesome for us. But I went to church, I went to the movies. You know, I was a little swollen or a little scaly, but I did say I want to wear a button that would say, look at me next week because it's going to be even better.
Yeah.
But it's not like you're laying in the bed recovering.
No, and I tell patients, because I have patients that, I mean, they might be my first appointment in the morning and they come in for their lasers and they've got full face makeup on because they don't want anybody to see them driving through the Kroger parking lot with their makeup not on.
Right.
My thing is, it depends on your level of confidence.
Yeah.
We don't care what we look like. A lot of people don't care. Go out and do whatever you need to do, stay out of the sun, but just who cares, really? Right. Now, if you care and you're worried and concerned, don't plan anything special. Don't plan on a dinner night with your girlfriends or, you know, going out with the guys or whatever. Just don't plan anything special, but please just don't stay in the bed or in the house. That's not necessary to do that.
Right. Great, great. So what is the best laser treatment for fine line and skin texture improvement?
Halo is going to be the best option for that because it's going to help with the crepiness of the skin. So fine lines are typically a little bit of crepiness, so it's going to stimulate collagen production. And then, what else did you say? The texture?
Skin texture.
The texture. So Halo is going to be better for that because it essentially burns off the skin. So it burns off that texture. Now, with that being said, for those of you who have like the age spots, or like my mom calls them liver spots, it's like the little black kind of crusty spots, or even the pre-cancer cells like the actinic keratoses, Halo burns those off. So that's going to make it a much better result. So I would do the Halo for that. If you're nervous about the Halo, which don't be, but if you are, do the BBL instead, or we have other treatments that you could do.
And Pronox is our friend. I agree with you. That was, it really changes the game.
It's amazing. It's a game changer.
Yes, yes.
I have patients that are so against the gas. They only want the numbing. They come in an hour early. They get numbed. And then the problem is with not doing the gas is you're still going to feel a lot with the numbing cream. And then if you're in pain, I guess, or discomfort, I can't go to the setting I want to use. I have to back it off because you're uncomfortable.
Right.
So it's really better to just let me do the gas.
Right. And in the picture that was frozen on the screen, she had the Pronox tube.
Was it
what she was, And she was, and that's what she was doing, was inhaling some of that Pronox. Next question, and I think this one's so good. Which laser treatment is best for acne scarring?
Halo is better for acne scarring because here's the thing about scarring. The scar will always be there because it's just damaged tissue that's just thickened and fibrous, so the scar is always going to be there. What the Halo will do is take laser channels and kind of burn through those fibrous strands and help to kind of break up that scar tissue. So the Halo is going to be able to treat the scars much better than really BBL would or chemical peels. Microneedling is a good option for scars, but the Halo is going to help with the acne scarring. Downtime is going to be a bit more. You'll be pink a little bit longer because the settings are probably one of the more aggressive settings we do because we really have to blast down through those fibrous tissues. Expect a couple of treatments, 2 treatments, maybe 3 treatments, depending on how bad the acne scars are. I oftentimes will like to do a series of microneedling treatments first to get the skin kind of prepped and ready to go using good retinols or Retin-A, tretinoin products, and then get you ready for the Halo. In more of an extreme case, then you could end up doing, depending on skin tone and things like that, you could do the CO2 laser with Dr. Moore or the TRL, which is the big version of the Halo, and that would be with Dr. Sorochik. Those are surgical procedures, though, so they wouldn't be something we would do up here.
Right. And if you call in and ask about this and are wanting to schedule one of these procedures, we're always going to say absolutely, but we're going to get you a consult first, and Heather's going to talk about all of those things. And if it is acne scarring, she would give you all the steps and get you on that road to help you get rid of those scars. Okay, next question. Are BBL laser treatments safe for melasma patients, or could this make the condition worse?
So BBL and IPL together, they are pretty much, they stay away from doing melasma, specifically if you're doing the wrong settings. So if we're doing the wrong settings for melasma, that can flare it and trigger it and make it come out worse. And I've actually had this with patients that we didn't know they had melasma. We thought it was just brown pigment or sun damage. We did a BBL, it looked great, came in to do the second BBL, and bam, there was their melasma. Now it calms down, it diminishes, you know, over time, but I don't like to do BBL for melasma specifically. I prefer to do Halo for melasma because I can tune the settings a little bit more appropriately with the Halo. And then I also do a melasma peel that we have in the office called the reverse peel. So for melasma, I like to do a chemical peel, topical skincare products like a pigment corrector and a retinol or Retin-A, Halo. We oftentimes have to do all of these together, obviously not the same day, but a series of treatments to give you the best results.
Right.
Melasma won't ever go away, but we'll be able to diminish it as much as possible.
Over time, yeah. And then which laser is best for deep wrinkles?
So if you were seeing us non-surgically or me non-surgically, I would do the Halo on you for deep wrinkles, and we would need to probably plan on doing about 3 treatments. If you wanted something further, then you would see one of the surgeons for CO2 or TRL, potentially even a facelift if you need that. And that's something about our office is when you come in to meet with us, because we do have plastic surgeons in our own surgery center, if we think that what we can do for you non-surgically is not going to give you the results you're looking for or expecting, we'll be very honest and say, I think you need to have a consultation with one of the doctors. Or likewise, they might see you for a consultation and say, why don't you go upstairs and get a laser consult, because I think that would be better. So we really want to be able to give you the best option. Although it might not be what you had anticipated, we really want to be able to give you the best option.
Right, right. Very honest. And then let's see, can the Halo BBL be used on chest and arms? I believe you talked about that.
Yes, and the thing is, I've talked about this before, the thing is about the face, neck, chest, or whatever, so many of us work on our faces and spend a lot of money on our faces with our Botox and filler and our skincare products and our facelifts, but we really neglect the neck and chest. And so, yeah, if you have this looking really nice, we do need to move down because this is kind of the picture frame of where everything is. So I would absolutely do BBL and Halo on the neck and chest, hands, lower arms. It'll be great.